Thank you. Mr. Kennedy, thank you for coming into my office and having the conversation that we did. I appreciate your passion and your belief, and you've spent years really talking about the issues that matter to you, and I appreciate that. Let me ask you a couple of questions, though I just need some clarification. Right now, there's a 40-year-old law that requires hospital ERs accepting payment from Medicare to actually provide emergency care to patients. So let's say a woman experiencing a life-threatening condition like a heart attack goes to the ER. As a lawyer, you would agree that that federal law protects her right to emergency care, correct?
Yes.
So now a pregnant woman with life-threatening bleeding from an incomplete miscarriage goes to the ER. Let me rephrase that so you can hear. A pregnant woman with a life-threatening bleeding from an incomplete miscarriage goes to the ER, and her doctor also determines that she needs an emergency abortion. But she's in a state where abortion is banned. You would agree also as an attorney that federal law protects her right to that emergency care, correct?
I don't know. I mean, the answer to that is I don't know. If the state bans
Well, let me ask you this as an attorney. Doesn't federal law preempt state law?
the federal Constitution does. Sometimes not every federal law preempts state laws. It could be unconstitutional. Now, I'm
Well,
not
I
trying
would
to
tell
be
you in this
evasive,
case, let me ask
Senator.
you
I'm
this.
just telling you I don't know the
I
answer
appreciate
to that
that.
question.
But what authority do you have over this as the director of HHS?
What authority do I have?
Yeah, to enforce the law,
In what regards?
to make sure that a hospital that receives payment from Medicare is ensuring that they're providing the necessary emergency care to patients when they present. It's actually the EMTALA law. So what authority as HHS director do you have with respect to EMTALA?
My understanding is that I have budgetary power and that it's pretty much limited to that. But if you tell me I have another authority, I don't even think that
Well, let me tell you,
we
you
have a
do.
law enforcement branch at HHS.
Actually, you do, and that's CMS. CMS actually investigates complaints of EMTALA violations, as well as the Health and Human Services Inspector General, who, by the way, was just recently fired by Donald Trump. So you will be enforcing EMTALA laws, and it's important that you understand their impact and don't play politics with the patient presenting at the ER based on a position that this administration has taken. Let me ask you another question. When we met in my office, you said about lowering drug prices, that when Big Pharma price gouges, the American people suffer. I think we both agree on that. And I think you're sincere in your belief that you want to reduce prices for Americans, correct?
Yes.
Yeah. The Inflation Reduction Act empowered Medicare to negotiate prescription drug prices. It penalizes drug companies for price hikes above inflation, and it caps seniors' out-of-pocket drug costs, along with reducing insulin prices to $35 per month. But your future boss, Donald Trump, on his first day in office, revoked President Biden's executive order that actually directed the health secretary to examine ways to reduce drug prices and improve access to innovative therapies for the American people. And unfortunately, Republicans in Congress want to repeal the Inflation Reduction Act, which means reversing all of those things that we worked on to lower prices for Americans. So my question to you is, what do you do? Why are you there? Are you there to be a rubber stamp to this administration and cave into all of these positions that they're taking, even though you know they're in disagreement with your positions on lowering drug prices and that they could harm Americans? How do you handle that as HHS director?
Senator, my understanding is that the White House issued an executive order, I believe today, supporting the drug negotiations under the IRA. President Trump was very aggressive during his first term about negotiating drug prices. He has instructed me, and I've met with him repeatedly on as that we need lower prices than seniors in this country, and
So let
and
me ask
others
you,
are.
let me ask you this, because I only have so much time. So we've already negotiated lowering prices for 10 drugs with Big Pharma. And Big Pharma, by the way, opposes this. They have not only are asking for a pause, they have filed lawsuits, but we've already negotiated the first 10 drugs. And we want to expand it to the next 10 to 15 that the Biden administration has put forward. Would you agree and continue that path of really mandating that Big Pharma come to the table and negotiate drug prices for Medicare so we can lower those prices for Americans?
My understanding is that the executive order that was issued today, which I haven't seen, but I've read a summary.
Well, let me ask you this then, because you keep citing the Trump administration and you're just going to follow what they say. Is that what you're doing? You're just a rubber stamp for them in this position? So anybody,
Trump.
so it doesn't matter that you're before us. It could be anybody coming before us as long as they're a rubber stamp for this administration and disregarding your beliefs and what you think. I guess my question to you is, if it really is fundamental to what you believe, how do you live with that? How do you address those issues as you're moving forward?
You want me to
knowing
answer
that
the
it's going to
question,
harm
Senator?
Americans? Yeah.
You want me to answer the question?
No, I'm asking you.
Okay. President Trump has asked me to end the chronic disease epidemic and make America healthy again. And I'm
So
in a
is that the
unique
only reason why
position.
you're at HHS? Is that the
Excuse
only
me?
reason why then you're at the HHS to address that one issue?
President Trump has asked me because I'm in a unique position to end that. And that is what I'm doing. And if we don't solve that problem, Senator, all of the other disputes we have about who's paying, and whether it's insurance companies, whether it's providers, whether it's HMOs, whether it's patients or families, all of those are moving deck chairs around on the Titanic. Our ship is sinking. Our 60% increase in Medicaid over the past 4 years is the biggest budget line now, and it's growing faster than any other. And no other nation in the world has what we have here. No other nation has a chronic disease. We have the highest chronic disease burden of any country in the world. We had, during COVID, we had 16% of the COVID deaths in a country. We only have 4.2% of the world's population. We had a higher death count than any country in the world. And when CDC was asked why, they said it's because Americans are the sickest people on earth. The average person who died from COVID, American, had 3.8 chronic diseases. This is an existential threat economically, to our military, to our health, to our sense of well-being. And it is a priority for President Trump. And that's why he asked me to run the agency. And if I'm privileged to be confirmed, that's exactly what I'll do.